Good afternoon everyone, and I'll be giving you an overview of acupuncture for pain. So what I'll be talking about today, basically what is acupuncture for anybody who may be unfamiliar with acupuncture, how acupuncture works, is it painful, the crucial question, the one that I often get asked, are there any side effects, acupuncture for pain specifically, and how many treatments are needed, and I'll then end with questions. I'll be happy to take questions at the end. To start with, what is acupuncture? So basically acupuncture, the earliest records for acupuncture were found about 3,000 years ago. It was set up about 3,000 years ago, but there's a theory that it's significantly older than that one. So acupuncture is a part of traditional Chinese medicine, and it's used for a whole range of conditions. And what it focuses on is that there is a balance of energy in the body. The idea is that if anything becomes stuck, energy that they refer to as qi, if it becomes stuck anywhere, you have pain in the body. And so what it does is it focuses on clearing any blockages, getting things to move properly, and basically clearing the pain as a result. So the as acupuncturists, we focus on meridians, which there is a picture of there of the upper part of the body. There are at least 390 different acupuncture points, just to give you an idea, and they're all over the body. So when anything happens in terms of pain, what we do is a full diagnosis, and we work out where the blockage is and what's causing the pain. So to unblock the pain, we obviously have to move the qi, the energy, and we use 3 different techniques. The main one is the needles, the acupuncture needles, which I'll talk about in a moment. Second one is cupping, which you may have heard of. It's suddenly become quite popular. People like Gwyneth Paltrow have suddenly turned up with great big blotchy marks on their back at events. That's cupping. So, and the third one is gua sha, which is also becoming quite popular for facial gua sha. Don't know if any of you have heard of that one. It helps just move the muscles, unblock any blockages, get blood flow to the area, increase collagen to the area, and just improves the health of the skin as a result. But we can use it on the back, which is the main place that we use it. So if you have back pain, severe muscular pain at the back, we'll often use gua sha as part of the treatment. So how does it work? Well, in medical speak, it's 2 very nice complicated things. It modulates sympathetic upregulation, and it encourages endogenous opiate release. Bit of a mouthful. Basically translated, that means that it encourages the body to release its own natural painkillers. So it also releases endorphins, which help calm you down. Cortisol levels all come down, stress comes down, it relaxes the muscle, and everything starts to flow properly. That's how it works. Is it painful? The really important question, the one thing that I hear all the time is, well, I don't do needles. You know, I'm scared of needles. I don't even like having an injection, so I'm not going to do acupuncture. So just to point out, sorry, I've just come in the way, an actual syringe is that blue one over there. So that's the size of a syringe that you will have had your booster or your vaccine. The acupuncture needle is that one there. The acupuncture needle can actually be passed through the syringe needle because it's that thin. It's literally the width of a hair. So it's very, very fine. Most patients will say that they don't feel most points when they've been putting it. They might feel a slight prick when it goes in, and after that, absolutely nothing. At other times, you might feel a slight sensation of electricity going through your body, but that's fine, it dissipates, or a dull sensation. So yeah, so it's not anything to worry about. Generally, I find that most patients will fall asleep during a treatment, and they're always worried that they're going to start snoring. So please don't worry, that's actually a really good sign. And the reason why they fall asleep is because it actually encourages the release of endorphins, which really calm you down. So are there any side effects? Now, side effects are very rare. And if you do have side effects, they're very mild, and it's short-term only. There might be a tiny bit of blood that pops up, which we just wipe away, and it solves the problem. There might be a bit of bruising at a particular point. It's generally where the point really needed an acupuncture needle. That's where you might bruise. We can generally, as acupuncturists, spot where it's going to bruise and give it a bit of a rub with a cold spoon or cold bit of metal, and that clears the bruise. Sometimes, occasionally, you do get a bigger bruise, but it'll be one of those bruises that isn't painful, it's purely discoloration, and it disappears after a few days. Occasionally, people feel dizzy, but as an acupuncturist, I always tell people to have something to eat prior to their treatment, because they often feel dizzy because they've turned up without having had eaten anything. The important point to note here is that if you are taking warfarin or any other anticoagulants, so sometimes called blood thinners, you can't have acupuncture, I'm afraid. What you could have instead is an acupressure massage. So that just works on massaging the meridians to get the flow moving and to clear any blockages. But acupuncture, I'm afraid, is not recommended in those situations. So acupuncture for pain, it's been great that the National Institute for Health and Care Excellence last year actually accepted acupuncture to be used in the medical profession, by the medical profession or within the medical profession for a range of different pain conditions. So I've listed them here. So chronic tension pains, which are very common, migraines, which unfortunately are also very common, musculoskeletal conditions. Now that can happen as a result of a trauma, an injury, just old age as well. You can obviously find that you just suddenly sit up or stand up and there's a twinge and you're in pain. So it can be something as simple as that. Chronic pains is just neck pain. During lockdown, a lot of people have sat in front of computers, in front of Zoom for very long periods, and chronic neck pain has become a bit of an issue, I'm afraid. Joint pain, so including rheumatoid arthritis, you can actually help to alleviate some of that pain. Dental pains and post-operative pain. When it comes to sort of general pain in the neck, we also cover the face as well, because it's often referred pain on the face. So the important thing to note here is that unlike painkillers, acupuncture doesn't just stop the pain. We focus on getting rid of the root cause of the pain. So that's what treatment would focus on. So it's not just about giving you a bit of a quick fix and sending you off, and then of course you're in pain a couple of days later. So how many treatments are needed? Now this is I'm frequently asked this question right at the start. It varies, unfortunately. If you've got a chronic condition, it might take a few more treatments, but generally we suggest 3 or 4 treatments and then a review. And then often treatments can be spaced out if it's has a really good impact. Generally, I find in my practice that I will say 3 or 4, but then by the 3rd session, they're just so much better that we're actually talking about spacing out acupuncture treatments for the next. And then the idea is to have somebody just turn up for maybe once every 6 weeks as a maintenance if needed. So that's not always needed. So any questions? And I know it was a short presentation, but I'd be very happy to take questions. Yes, thank you.
What about fibromyalgia?
Yes, I do actually have a few patients with fibromyalgia. It does actually really help with the pain, but obviously it takes a longer number of treatments. And we try to get to the root cause of fibromyalgia. So with fibromyalgia, it has a slightly different diagnosis in Chinese medicine. It's not a medical condition in Chinese. It's seen as a bunch of symptoms. So yeah, it can certainly be used for that one as well. Yeah, I mean, it's not recognised by NICE yet as being a reason for but having said that, you could go to an acupuncturist and that would certainly be treated.
I have to say, I had a really nasty case of tennis elbow a few years back, and it was brilliant. I could feel the warmth going into the joint, so I'll definitely recommend it.
Great, and it's not just tennis elbow; it's golfer's elbow as well. So yeah, so golfer's elbow as well. Yes. It's very, very good for that one as well. So it's very good for musculoskeletal stuff. Yes.
How do you get this referred? Is it self-referred?
It can be done 2 ways. You can talk to your GP. You'd need to see whether they'd be happy for you to have a block of treatment as part of their practice. Some GP practices are opening up and actually including it as part of the treatment package. The other option is private insurance. If you have private insurance, you can certainly check with your insurer as to whether they'll let you come and see an acupuncturist. Most of them will, because it's recognised. You just need to double check that they cover it, and the only stipulation is that it has to be a British Acupuncture Council member, and I'm a British Acupuncture Council member, so yeah, Any other questions?
I would just add to that our practice, Devon Common Practice, did have a GP who was an acupuncturist. So we were lucky, that's how I got my
Okay, great. Great. Are there any other questions?
If an acupuncture therapy session doesn't work first time, is it worth doing it again?
That's a very good question. It is cumulative, so it might not have a massive impact the first time. It builds. It's like having a course of antibiotics. You wouldn't stop on day 2 because you just feel better. You would want the whole course. So the idea is it builds on itself, and the aim is to get to a point where you don't actually need it. You're just kind of, a lot better. But that's a really good question. Any other questions? Thank you so much for taking the time to listen to my presentation.